because there's so many scars, and because I had infections and skin had to get changed out. And I feel like, the doll that's been resewn so many times, and just, I don't really look at it without clothes. In clothes, I feel very confident. I feel great. Like, wow, I've gotten my weight under control, because I did have, after the treatment, specifically the radiation, because I had radiation for a very long time, it affected my thyroid, and then I lost weight and gained weight, and then I had my sugar went up, and all of these things happened, and now it's all under control. I'm at a good weight. In clothes, I feel extremely confident.
Welcome to the Two Curious MD podcast. I'm Dr. Alya Ahmad.
And I'm Dr. Sara Ahmad.
In this podcast, we are asking the unasked questions.
We're physicians applying the lens of narrative medicine, exploring integrative practices and psychedelic treatment in healthcare.
Together with our guests, we weave new learnings from stories, expertise, and the sciences. With the wisdom from holistic, alternative, and these conventional medicine, we are here to challenge the status quo.
We're curious about the connectivity and complexity between diverse fields of knowledge as they relate to consciousness, chronic illness, mental health, resilience, and beyond.
Learning more about the art and science of healing, or listening to stories of extraordinary healing. You're in the right place. Let's dive in. So good afternoon, Sara. Great to have you on the podcast today. This podcast, as we spoke about earlier, is called Two Curious MDs. Really begins with learning, and in medicine and in healing. As a physician, I've always felt that understanding the person, the patient, not just the illness, but who they are, and really becoming curious about what it is like for them in their condition, and asking those questions that we often don't ask. And sometimes those questions can really allow for that deep understanding of the root, sometimes of conditions, but also the effect, and sometimes even more of the allowance of that empowerment that sometimes we as physicians don't really talk about. What is it that the patient imagines in their treatment course of their condition? So thank you for being here. Again, in Two Curious MDs, we kind of have fun as well in these episodes, and so feel free to ask me questions too. And this is our living room conversation. So I'm so glad to have you here today.
Well, thank you. Thank you for having me. I feel honored to be on your podcast and talk about my journey with breast cancer. I think, unfortunately, it is something that a lot of women are facing today. I hear more and more friends and acquaintances that have either gone through it or are being diagnosed with it. I think in our world today, we are impacted by so many chemicals and so many things outside that are doing these things to our body, and we don't know it. I'm, to date myself, I'm a 70s and 80s kid, so I probably grew up with a lot of kind of the junk food and the things that were there that were put inside my body, and into this journey that I faced. I did not have the BRCA gene, so I didn't really have any family history of breast cancer. So when I was diagnosed, it was quite a shock, because I've also been relatively healthy. I was always on the go. I'm sure there are a lot of moms out there that have faced the same journey. And I think as mothers, we have this strange adrenaline that we function through a lot of illnesses. It's like, if I would get sick, I would still do all the things that need to be done. There's really not, I'm going to lie down in the bed for a couple of days and kind of heal. I think as moms, we still kind of go out and do the driving and do all these things, and we just deal with the illnesses that we have. So my journey kind of started that way. I think, I know that I had the cancer for a really long time that was undiagnosed. So I actually had a clean mammogram in January of 2019. I was very diligent about getting a mammogram every year. I skipped my 2018 mammogram because we moved to California from Arizona. So I didn't have it done in 2018. In 2019, I got my first one here in California, and that became what they called my baseline mammogram. But somehow the cancer was missed. Um, Around August of 2019, I noticed a physical change on my left breast. I always describe it like it looked like when you buy chicken from a grocery store and you see the yellow fat that's under the skin on the chicken. That's what it looked like on my breast. And to me, I thought that doesn't quite look right. That it doesn't look like a stretch mark. Looks kind of weird. Maybe I should get it checked. But again, we're in the mom mode. I had, 3 kids at home. I had one kid in college who was just about starting medical school. So I have 4 kids. I'll introduce that. I'm Sara Qureshi. I don't think I even introduced myself, but I have 4 children. My oldest daughter is 28. She's actually an OBGYN doing her second year of residency in Boston. I have a 21-year-old daughter who is graduating from the University of California, Santa Barbara in June with a chemical engineering degree. And then I had 2 late in life children. I have a son who is 12 and a half. He will be 13 in July, and a daughter that just turned 11 in January. So I had very young kids at the time. And I was just really busy. It was kind of like I'm on the back burner, and I said, I'll get this checked at some point. Luckily, my OB happened to be a personal friend. We created a friendship through our kids at school together. And it was nagging on me that I should call and probably get it checked. And October is Breast Cancer Awareness Month. So by October, I thought, I really need to get this checked. And I called her and the office, and they said, yeah, just come in and she'll look at it. So I went in and I had her look at it, and I could tell by the look on her face, though she tried very hard not to, give a tell. But she said, it could be a fibroid. It could be nothing, but let's get it checked. And I really want you to go to the specific place and see the specific doctor. So I kind of knew that something was up, like there was going to be something there. So my journey started in October of 2019, right before the pandemic hit. And so fast forward, sure enough, it was breast cancer. They knew right away. Originally, they were like, oh, it's stage 1, it's okay, you're going to be fine. It then progressed. By the end of my diagnosis, it was stage 3C. I was just a step away from it being terminal, which is stage 4.
Stage 3C. Okay.
Yeah, so it was stage 3C. I ended up having progesterone, estrogen positive cancer. It was in all 4 quadrants of my left breast, as well as 13 out of the 15 lymph nodes that they removed from my arm. So it was a pretty harrowing journey as we were getting there. And I think one of the things as patients that we feel is there doesn't seem to be a lot of urgency when they diagnose you, though they say it's a big deal, but I heard a lot, well, it's not going to grow that fast. So chill out, pretty much. I think when I first got diagnosed, and I really didn't tell my husband right away. I told him a little later, and he was really upset. And he said, "Why is it taking so long for you to get a biopsy? Why are they not doing it right away? Why is this 2 months out for you to get a biopsy?" And I said, "Well, they don't have room. You call and you schedule, and they're like, oh, we don't have an appointment available." And he was very upset. Like, this is not something that can wait. And they kept saying, it's not going to make a difference. 1 month isn't going to make a difference. It just, you feel a lot of that as you're going through it. And I think that when I got diagnosed, my initial reaction was, I just got to get through this, and I can deal with the emotional part of it a lot later. Let me just get through everything. Let's just get through everything. Let's just do this double mastectomy as quickly as possible. They told me that I could just have one removed, and I said, no way. I'm almost terminal 4. Why would I take a chance that it's going to come back and go through another surgery? I really didn't want to. I also felt that at the time, I wasn't quite 50, almost there. And I said, I don't need him anymore. I breastfed 4 kids. I'm married almost 30 years. I just didn't feel that I wanted to take that chance. I just felt like they've done the job that they needed to do. And so I made a quick choice that just do the double mastectomy. Let's just get it done. They did, push ahead and I got it done over Thanksgiving. Um, but I think one of the hardest things is at that time I was in survival mode. So I didn't really think about it. I just did it. I went through 6 months of chemo. I went through 4 months of radiation, all through COVID. And I kept thinking, I've got to get through this. I've got to get through this. And then I can deal with the emotional part of what happened to me. And I think, and because it's just, there's so much medicine involved, there's so many doctors, there's so many appointments, there's so much stuff. It's really hard to deal with the emotional stuff. And I didn't really deal with the emotional stuff until after the fact. And I think that's maybe something we probably need to look at in healthcare. They did assign me a counselor, which was great. And I did see her multiple times to help me kind of process what was happening. Um, but I think I've always kind of had the attitude of, I never really dwelled on why did it happen to me. I think a lot of people are like, oh, why me? Why me? I never have thought that. And obviously because of faith as well. I have a lot of faith and I do believe that whatever God gives to us is what we can handle. And so I never really questioned that. I think recovery was really difficult because I didn't really deal with all the emotional part. They don't really talk to you about, I guess we can be frank on this podcast, right? It's
Yeah,
that when you lose your breasts, it's really a big deal. Like,
it
I
is.
thought it's not going to be a big deal for me. I really don't need them. Like, how great. Like, I don't, it's weird. Like, at first I was like, I don't have nipples. This is great. I can go braless. Like,
Yeah,
I don't have to worry about being cold in a room. Nobody's
yeah,
gonna know, right? I kind of looked at it with like a sense of humor.
yeah,
I've got these like perky boobs again, but it is a really strange feeling. It's like I have that phantom limb syndrome. Um, you, I have no feeling there. I mean, they could be on fire and I wouldn't know. It's the
yeah,
strangest thing in the world. Like I hit things all the time and I don't even know, right? I end up
yeah.
with bruises and I'm like, how did I even? It is a very strange feeling to not have that as a woman, especially I think, I mean, whether you breastfeed or not, or I guess to just not have that feeling. It's a very strange process. And I'm not sure how we ever can get past that trauma. I mean, I think a lot of humor. Some of my friends that have gone through the things, we joke all the time about how they're constantly cold. They're always cold. There's no nerves, there's no feeling, there's no real
Mm,
flow. It's
yeah.
a very strange phenomena. I mean, I would say the only perk out of the whole breast cancer thing for me is that I did the deep flap procedure. I don't know if anybody's familiar who's listening with that, but because I had 4 kids and I was on the heavier side, I
Hmm.
had enough fat in my stomach for them to remove my stomach fat and recreate my breasts instead of going through implants. It's a really, really difficult procedure. I had a lot of infections. The recovery was intense, but I did get a tummy tuck out of it, which for my self-esteem after all of this was a really big positive. Uh,
Yeah.
to this day, I think that's something that I feel good about.
Well, I'd like to there's several things you've talked about. One
Sure.
is what's not asked, what's not, as you kind of walked this journey and had to
Mhm.
kind of navigate it for yourself and recognizing the resources that you already had and relying on that in terms of your faith, your family, even yourself, the resiliency that is needed. And but I'd like to kind of ask about those unasked questions, right?
Sure.
Which is, we talk about this in integrative medicine. What is it that, why are certain conditions present in some people and why in not in others? What is it about women, and a particular kind of cohort of women who get breast cancer. For instance, um, female nurses have a higher incidence of, say, having breast cancer compared to normal population. And what is it about that type of person or character or career, or the people who give and are able to work and multitask and manage, and yet aren't always receiving on the
Right.
receiving end of giving, for instance. But in terms of trauma, when we think about trauma as a condition that most people have had some event of trauma in their life, whether it was early childhood trauma or later on in their life, but that impact that trauma has on the body, where it tends to live, right? What would you say about your early life, or even later on in your life, indicators that put things to question in terms of trauma? What was it like for you growing up as a child?
So, I think when you say, I'm definitely a multitasker. So growing up, I'm a child of immigrants. My parents immigrated from their home country very early on. They got married in like, gosh, 1962, something like that. And then immigrated to England. I was actually born in England. From England, they then immigrated to the United States, like 1974, 75. So I was quite young when we came to the US. And so my childhood was always that kind of navigating, because your parents are kind of new to the place, right? And again, like I said earlier, it was the 70s and 80s. I think we just had everything was introduced, like processed food. I think our lifestyles changed dramatically. I didn't, thank God my parents were very kind parents. I didn't have any trauma in terms of any kind of like physical abuse or those kinds of things. I think there was an intense pressure to succeed and to be successful because you are a child of immigrants. My dad is successful. He was an engineer, but it was really a big deal to go to school and get A's, and that's kind of all they thought, right? If it was
Yeah.
anything else I wanted to do, it was sort of like my own doing. It wasn't really like, okay, they were, oh, why don't you try this and try this? It was sort of like, go to school, get A's, and that's what you're supposed to do. And then you go get married and then you start your life, right? I think that I think the trauma that affected me personally, was kind of fitting into the society here as a child of immigrants. Um, when I grew up, you know, there weren't a lot of Asian immigrants, especially when we left Virginia and moved to Arizona. Virginia was probably more diverse. And we left Virginia when I was in junior high school and I came to Arizona, and there wasn't a lot of diversity in Arizona at all. I mean, people had no idea where I was from if I said it, and they were like, okay, whatever. And so I kind of had this feeling of not quite belonging 100%. So I think that kind of emotional um, trauma was there for me, which also made me very thick-skinned and a multitasker and somebody who could probably deal with a lot of things. And that's probably why when I got the diagnosis, like, okay, I just have to deal with this. I'm just going to have to do this. I can still manage everything um, and deal with it. It's weird because COVID was kind of a blessing in disguise um, for myself and my family with this, because it forced everything to shut down. And as a result, we weren't trying to figure out how to manage getting the kids to school and to their sports. And my daughter was sent home from med school, and she kind of helped take over the house, which was primarily what I was doing. Um, my husband started working from home. It just became hyper focused on I'm having this going on and everybody's going to help now and everybody's going to take care of me. But it was really hard to be taken care of. I do have to tell you that
Yeah.
it was really, really hard. I really didn't ask for a lot. I mean, I ate cereal most of the time because I couldn't eat a lot. But I was like, no,
Yeah.
no, it's okay. I'm just gonna have a bowl of cereal. I just am a person that is not used to that. I'm used to the one that's always doing those things. I think the trauma of the part about COVID that was scary was that God forbid if I got it, what would we do? Because I had no immune system at the time. And that we were seeing all these things and it was really scary. So we were very much hunkered down. We
Mm.
ordered everything. We didn't really go out. Um, I don't know if that's the question, if that kind of
Yeah.
answers your question.
It does in some levels. I think the migration, and this has been seen as well, women who have breast cancer from one area of low incidence, then coming into another part of the world where the incidence is higher. Again, the diagnosis occurs, whether that's related to the environmental change or either the socio-demographic change, or whether that's related to nutritional change,
Right.
or a combination of all of those things in light of that migration and the stress that occurs in the body. The other factors that come up in terms of incidence is also age of onset of a period of menarche,
Oh, okay.
and that
Yeah.
is effect on a young child based on a different environment, different timing, delayed onset of children having children at later age or reduced breastfeeding. So it's very interesting to hear components of that occurred for you in your life, coming from an area where food is different,
Right.
and how nutritionally depleted food is here in this Western world, but still access is still readily available, and that whether that's a systems change that the body notices right away, very subtly, and responds to it in that way. There's so many things, but there is correlations there for chronic stress, environmental.
Yeah. And that's what I was told, that stress, was one thing that really is impactful for people with cancer. I've been told that by my oncologist over and over again. And even the therapist that I saw is you cannot have stress because that's what feeds the cancer in your body once you have it. And I did have a very stressful life after my marriage. We were traveling a lot. Back and forth between where my husband is from and here. And, we have kind of had an up and down situation as a lot of people do. And I think that, impacts it as well. Um, I do think in myself that because I was progesterone and estrogen positive, I had my first two children early in life, my oldest obviously early, but my last two I had after 40. And they gave me progesterone shots when I was pregnant with them because my first two kids were premature and they wanted to make sure that I didn't have a premature birth again. And I always think in my head that, I did that for 2 years literally because I had my son and then 6 months later I was pregnant with my daughter. So I had this quite a few progesterone shots. Um, I don't know. I mean, years of birth control. We had a big gap between our children. There's lots of factors that I think probably contributed to this onset for me. I do think the types of food that I ate as a child and even older, I'm somebody that loves junk food. I just grew up with it and I really like it. And it was not good, and I've sort of taken a step back. I mean, when I was pregnant, I craved cheeseburgers like crazy,
Yeah.
you know. And they do say those things are just so impactful. Sugar,
Yeah.
Generation X, we are like sugarholics. I don't know.
Yeah. Well, I mean, it just, it's the perfect storm, right, of things.
Right,
And inflammation being one of them as a setup for sometimes any kind of condition, but specifically for cancer, of course. Um,
right,
there's a lot of discussion in the Women's Health Initiative that came out with the published studies on the effect of estrogen and hormone replacement and that risk, of course.
right,
However, there's variable schools of thought on that. Um, and knowing that in integrated medicine, we talk a lot more about inflammatory factors that have effect on cellular mechanisms and DNA replication and mutations, and epigenetic markers that may exist, especially in different cohort, that um, become more turned on, I guess, when they're in a different environment.
Mm.
So South Asians in general have a higher risk of diabetes. But why is that? Because we're programmed to be in a starved state, and so when you're not in a starved state, the body just doesn't know what to do with all that extra glucose and tends to uh,
right.
either store it or become more ineffective with those pathways of insulin. And so if you look at that, and why is that? Because again, we were generationally prior to
Right.
migration, programmed to be in a starved state. So that same sort of response to conditions related to inflammation tend to be um, more sensitive to different populations, again, because of their historical genetics.
Yeah.
So knowing this now and hearing this uh, part of why illness manifests in your body, um, and feeling working through that with the resiliency that you already have as an immigrant, um, where do you feel your body is now, um, and how do you see yourself in the body that you're in now? We spoke a little bit earlier about that, seeing it, you are work through, the systems of medications and processes and doctors, but now as you see yourself, how do you see yourself now through this illness?
I definitely see myself as stronger, um,
Mm-hmm.
more resilient. I think that, um, I'm happier with my body because physically I was able to have that change, so I think that that gave me, and that just has to do with women and body image, which is such a bad thing that we have. But I definitely feel better about that. I don't think that I can physically look at my body anymore. I think that's really hard for me. I can't, because there's so many scars, and because I had infections and skin had to get changed out. And I feel like, the doll that's been resewn so many times, and just, I don't really look at it without clothes. In clothes, I feel very confident. I feel great. Like, wow, I've gotten my weight under control, because I did have, after the treatment, specifically the radiation, because I had radiation for a very long time, it affected my thyroid, and then I lost weight and gained weight, and then I had my sugar went up, and all of these things happened, and now it's all under control. I'm at a good weight. Um, so in clothes, I feel extremely confident. In terms of my body, I finally, I think in 2024, I felt back to being normal. So it took a long time. I was diagnosed, had my first surgery in November of 2019, and I honestly didn't finish all my treatments until 2022. So, I had all my chemo and radiation, and then because I was going to have that other procedure, they had to wait for everything to heal, my skin, my body, from the chemo. So that it took almost a year, of walking around. I don't know if people know that when they give you a mastectomy and you're going to get your new breast or whatever you're going to get, they put expanders inside, and they're awful. They're just the most horrible feeling in the world. And I had to have those for over a year. Um, so it was such a relief when those left. Um, so it took a really long time for me to kind of just feel like a normal person. My hair grew back. Um, it didn't grow back the same. Those kinds of
Yeah.
things make me sad, that it's not like what it used to be. It's, all of these things. Um, I do feel that it created a veil on my face that I can't describe, but when I meet
Mm.
women that have had breast cancer, I
Mm-hmm.
can tell. I feel like I can tell looking at someone's face. It
Wow.
does something to us, to our faces. I don't know if it's because, that after you have breast cancer, you have to be on a hormone if you're progesterone estrogen positive.
Yeah.
I know there's another type of breast cancer, and I'm drawing a blank right now, HER2 positive.
Mm-hmm.
Um, that's different. But when it's, hormone positive, they put you on a hormone blocker. So
Yeah.
basically blocking all the estrogen out of my body.
Right.
I think I have more testosterone than I have estrogen. And I do feel that I feel like on my face, I feel it myself. I'm sure my husband feels it mood wise.
Yeah.
There
Yeah.
is it does affect you. I mean, I think I went through menopause lightning fast. So it's like I didn't even get to deal with menopause like most women deal with menopause. It was just
Yeah.
like fast, hot flashes coming. I still get them, but it was like wham bam, you're done. And
Mm-hmm.
the mood swings and everything is just coming on so fast. But it does give you a certain strength. I mean, I think, and I don't know if women feel like this, and maybe this is why women, I think during menopause and after menopause, I feel like we become empowered.
Yeah.
Because I feel like I don't filter myself like I
Yeah.
used to, because I
Mm-hmm.
really, you're kind of like, I really, it's okay that I feel a way I feel. I'm just gonna
Right.
say it. I don't know how to describe it, but
Yeah. Well, you said you can see it in other women, the veil. You describe
yeah,
it as a veil.
yeah,
More
it's like
about what it looks like in the veil over your face or a veil. How would you tell me more about
it's
what
sort of
you?
like on your face. It's like you can see the journey of the cancer in the face.
Yeah.
I don't know if it's a harshness we get or it's the trauma that we go through.
Right.
But it's something you can see. And I don't know if other women see it. There's another influencer on like she's an influencer and I think they're called Home to Edit or Home Edit, where they do organizing. Like they organize your
Yeah.
home, super famous. And her journey was very similar to mine. And I've always thought about, God, I don't know how I would contact her. I think she went through it after me, but I so wanted to just be like, I know exactly what you're going through,
Yeah.
but I can see it on her. Like
Mm-hmm.
I see it. And I don't know.
Yeah.
I'm not sure.
Well, is it the armor or the strength or the
Yeah,
internal strength or the
things like
resiliency
that.
that
Yeah.
shows up in the face, right? Just like a wounded warrior,
Mhm. Yeah.
once they're coming
Yeah.
back home. Um, you know,
It's like
I,
it's also a weird strength. You know what I mean?
yeah,
Like it's a trauma, but a strength at the same time that appears.
yeah,
Yeah.
yeah. I'm very curious about that. I am a pediatrician, so I haven't taken care of women um, in that stage of their life more. But now, as the work that I'm doing with at Shawn Minds and in with ketamine assisted therapy and um, in trauma work and treatment resistant mental health conditions, there is a face of trauma, I would call it. There is a face of depression. There is a face of anxiety,
Yeah.
and of course there is, because there's a cellular effect of what depression does to the body, when somebody is depleted, or
Yeah.
the cellular changes are there, those mechanisms are there, and of course collectively it's seen as such.
Yeah.
Anxiety, increased inflammatory markers, unable to sleep, unable to, hypervigilant, so eye movements, muscle, reactivity,
Yeah.
is much more sensitive. Brain map, if you look at a brain map on a patient who has anxiety, they have different waveforms and it presents in different parts of their brain because, and how does that manifest itself physically,
Right.
is what you may be seeing or noticing because you can see it. You've experienced it
Yeah.
and can, those subtleties are apparent to you,
Yeah.
it appears. Um, and with that said, sometimes when we treat patients for depression who have been depressed for years, their physical face changes.
Yeah.
You can see, um, the effect of what empowerment feels like, and you can
Mhm.
see that light in the eyes, the awake, the alertness, the posture, the muscles, chronic depression, fatigue, affects again the,
Right.
way our muscles relax and tense. And we can see that change, of course, when we treat patients with ketamine, they physically look different. And it's fascinating to witness that and see the benefit of treatment for that very reason, because again, that affects so many other factors in your life, such as your relationships, such as the people that you can communicate with. In narrative medicine, we talk a lot about, the description of what cancer, kill cancer, or I've got to fight cancer, or it's
Right.
about a war against, a disease.
Yeah.
And
Yeah.
it's often described in that way that you can go back to normal, you can go back to what you were before the cancer diagnosis. And that's that restitution narrative, right? That
Right.
I was this person, I was
Right.
an athlete and then I got cancer and then I went back to becoming an athlete. And that's that arc of going back.
Right.
Then there's that chaos narrative where it doesn't make sense, and we witness this too in the condition that when patients present, it's like nothing's making sense. I don't know why this is happening. Everything is meant, everything is falling in this way, and I'm in the chaos of that, and the
Right.
body's responding in that way as well, in terms of chaos, disorganization, unable to focus, can't function. And then there's the quest narrative, which is I have a condition, a chronic condition. It is has an impact, and then evolving through that impact to something that we're not sure of till it
Right.
till we get to that place in our life, in our journey, in our illness.
Right.
What would you, how would you describe your journey, um, as your own, in your own story of your illness?
So I think it was definitely more the, okay, I need to kind of fight this. I need to be the fighter. Um, but then I started feeling like, I think I heard somebody say, or I was on a breast cancer forum, they give you all these things that you can to help you kind of get through it, talk to other patients and things like that. And they were saying, they say we're warriors and, you're a survivor. Like, because like I fought harder than somebody else, so somebody else didn't survive and I did. And then I started feeling guilty. Like, that's
Yeah.
not right. I don't want to be that because I don't think that I fought any better or different than somebody else that didn't survive. That's just the hands that we were dealt, I mean, I was so close to being terminal that it could have gone a very different way.
Yeah.
And I think that when you are a survivor of breast cancer, you're always thinking about when is it going to come back and where is it going to come back and when am I
Yeah.
going to longer be? And that's a huge burden to carry. And I feel it often. Um, and I think one of the things when I was going through this journey and I found out I was advanced as I was, I just remember praying to God and saying, you know what? I literally calculated in my head that when my younger kids were going to go to college or when they would have be old enough to maybe manage the loss of their mother. And I really just said, can you give me 10 more years? Like, please just give me 10 years. Like 10 years was my magic number.
Hmm.
Like, give me 10 years and and I promise I'll try to be the best that I can be. We do those where you make like a deal and then you realize like God is supposed to be, beneficent and merciful. And I don't think he really needs a deal. Like, he's just
Yeah,
do it
yeah.
or don't do it. But we do that, right? My gosh, I'm gonna like do this. But it was give me 10 years. Like I know in my heart it's gonna come back. Like I know it's going to be the thing that takes me down the road. Probably because it was so advanced. Maybe if I was stage 1 or stage 2, I would have been no, but the fact that it was as far as it was, I I do know that. And I do think, hopefully it'll be longer than 10 years. Hopefully um it will be. But I really prayed for that magic number. And now I realize it's kind of how can you say that? Your kids are always going to feel the loss no matter how old they are, or they're always going to have that loss. But I was like quickly calculating, maybe my oldest will be get married by then, maybe I'll be a grandma by then, my youngest will go to college, that will be okay. My husband can survive okay without me at that point, and everybody can survive, everybody will be able to move on easier.
You know what you're describing, and I'm sorry. I think
Okay.
it's a it's a question I ask for myself, and I think about asking this question to patients as well. And it's going to sound a little morbid, but I'm going to ask you because you're describing something that I think is very important to to highlight. Um, we're all going to die. Every person in this planet is going to have their death. Knowing that date would be great, but we don't. And knowing, how we're going to die would be awesome. I wish we could read the future, but we don't know that. And we often talk about, well, how do you want to live? How do you want to be? What do you want to be when you grow up? What is it that you think about is important to you? What is your purpose in your life? But I'm going to ask a question kind of differently. Um,
Mhm.
what is your journey to death look like? How
Mm.
would you want your journey to death to look like in the time that you have for however long you have? And I want you to just kind of before answering, just really just kind of meditate on that. What your journey to death that you want it to look like.
That's such a hard question. When I first was diagnosed, I think I did think like that. And I was like, I'm gonna focus on the moments that I have and make them really good. And then I think that as we progress and maybe as we get healthier, because I feel like I'm caught up in the same rut and cycle of life that I was caught up before the cancer, where I'm busy and I just am like focused on everybody else and doing all those things that I don't think that I've lost sight of what my journey is to death, I think. But I'm a very pragmatic person, and I think that I see my journey to death in how can I make sure everybody else's life is going to be okay.
There you go.
And that's the thing. I think when you ask me that, my first thing is, okay, well, I want my kids, I want my daughter to get married. I want her to have kids. I want my second one to get married. I want her to start her journey and have children. I want my son to go to the university that he wants to go to and, do what he wants to do. And I want my youngest she wants to be a physician like her oldest sister, and hopefully she can make that journey. How can I empower them to have the life that they want? That
Mhm.
would be my journey to death. But then when you look at it that way, it's not your journey, it's their journey. And I don't know as moms if we lose sight of our own journey. I don't know. I
Well,
don't have,
recall the etiology, right, that we spoke about in the beginning is like, why, what is that person who gets this kind of condition? What are they like? They're
yeah,
always thinking about others. They're caring for others.
yeah,
That idea of self-care, that idea of is really foreign. It's something, they're functional, they're pragmatic, they're
yeah,
resilient, and they've worked through some things they probably haven't even spoke about with many other people, or maybe not, and then you talked about relapse,
yeah,
you know so imagine what you just shared about that focus on the moment that matters. um,
yeah. I think,
what that would look like
and
for
one
you.
thing I did get out of it is that, there are certain things that I have no control over and I can't fix.
Yeah.
And I think I pick and choose the things that are going to stress me out,
Yeah.
right? There's
Mm-hmm.
just certain things that I'm not going to be able to change it. There's certain, maybe relationship aspects with my husband that aren't going to change no matter what I do. And so
Yeah.
I'm to just deal with that part of it and say, that it is what it is, and I need to get past that. Or whether my daughter is going to meet her Prince Charming. I'm not really able to control that, right? That's out of my
Mhm.
control. So worrying about it is not going to make it any better. I think also I do feel that part of my journey, again, it's with other people. It's about other people. I'm a professor. That's my
Yeah.
profession,
Yeah.
professor of political science. And I think that what I do, it's just part-time. It's not something that I do full-time, again, because my kids, I can't focus on it full-time and be able to run everything that I have
Mm-hmm.
to do. And I'm blessed to have the opportunity. I do need to say that I'm blessed that I have a husband that can provide for us, that allows me to make that choice.
Yeah.
I I do feel like I have this ability to influence and empower people to make an impact on the world. When I go in and I teach, that's my focus. My focus is not to influence my students to be a Democrat or a Republican or whatever. It is
Mhm.
to tell them that they have an impact on our society and that they do have an obligation as a citizen of our world and our country to make changes and to contribute. And so I do see that as something that I feel is part of my journey. And like you have a
Mhm.
podcast, something that I would
Yeah.
envision that I would like to do for that part of the impact, like to talk about societal issues and, political issues and issues that we face as moms, uh,
Yeah.
that we face as moms from other cultures.
Yeah. Mhm.
Uh, I think we do worry about that in our society, the cultural aspects of
Mhm.
things. Um,
So I'm going to pause here because you
mhm,
mentioned a couple of good points. One is you can pick and choose now
mhm.
versus, I don't know, before.
Right,
You have recognized that there are things that you can control and things that you can't, especially
right,
when it comes to others. Um,
right.
and that sounds like there's cohesion with that
Yeah,
decision. You mentioned balance, that you can balance both important aspects of your role as a woman,
mhm,
wife, balance, mother, balance, work, balance, but and that could be seen as a compromise, but it's really the balance that you're really
right.
seeking for yourself. Um, and then the influence on others, having that impact
Yeah,
for
yeah. I
others.
think that's something that I would like to go out with people saying. I think when you're on a journey where you think that death might be coming, you do start to think about, it's funny because everybody thinks, okay, what are people going to say about me? But you're going to be dead. It doesn't matter what they say about
Yeah,
you. Right, right?
so true.
So
Right.
it's like, well, I'm like, what does it really matter?
Oh
But
no.
it does matter in that I would like that people would say things that, this person did something that impacted something in my life, something and made me choose a journey or think about something in a way that I didn't think about before. I really think it's important that when people disagree, they learn how to disagree. I don't think that if we disagree about politics or we disagree about things that we necessarily have to hate each other about it. And I think
Right.
that's important. I try to really instill respectfulness for different opinions because everybody has different things that happen to them in life, which impact how you think about things. We all have different circumstances, like you asked about trauma in the beginning, like how that would impact you in a journey um, as such. And I think why we all deal with things so differently, dependent on what factors influenced us as children. Just like you were saying, I remember hearing or watching a TED talk about, like, as you were saying, that starvation mode versus the not, and where they're seeing higher obesity in women, pregnant women, who came from maybe immigrant backgrounds where they were necessarily starving, especially after World War II. Like, they talked about some of the Russian women who had
Right.
children because Russia went through such a bad winter with so much starvation. This is the professor coming out at me, but that they
Yeah.
were peeling leather to eat that, right?
Yeah.
And they had these children, and the children were basically nurtured and developed in a starving womb. And then all of a sudden you have this onset of a lot of food, and you had a high obesity rate,
Right.
right?
Yeah.
Because that's not what they were formed thinking. So yeah, I mean, I think that all of our journeys are impacted by not just genetics, but I think environment as well. I mean, genetics is huge. We can't fight genetics. I mean, maybe we can with AI later on. I don't know.
Yeah,
But
regenerative sciences is on its way,
it's
to
on
get
its
a
way.
new lung, regeneratively. We have the technology
Yeah.
for a lot of these things that are considered, cutting edge, but we do have the technology. I think the healthcare system itself is usually lags behind the
Yeah.
cutting edge. Part of that has to do with implementation and education and training, the students, the
Yeah.
residents, training with technology. Of course, now AI has changed a lot of that. Education, I'm sure you're seeing that too.
Oh, yeah,
Access
I
to
do. Yeah.
information is much more. No one has to go to the books anymore. I have stacks of books. But
Oh, I know. Yeah. I
yeah,
mean, I'm old school. My thesis was on DOS. I mean,
yeah,
was on a computer on DOS.
yeah,
I mean, I had to use books and microfiche to do my
yeah,
research. I
hmm
did not have the internet.
yeah.
So
Well,
everything is at our fingertips these days.
and my last question is, if you had to really feel your your joy, your love, your sacrifice, or um, and I say this to my patients, it's not about treating the pathology in you. It's about healing your well. Heal my well is what I say. Heal my well, like because we kind of we want to get rid of things in our body, but what is it that you can do in your life now that would heal your well, meaning the things that are already good about you, already cellularly, whether that's um, your mind or your body. Heal my well, like supporting the things that are in your life or in your body that brings one to a healing, but in a very natural, healthy way of living, say.
Oh my gosh, that's a hard question. Like, do you mean like, exercise,
Yeah.
diet? Or do you mean spiritually
All
or?
of that. All of that.
Yeah,
It's healing your mind, body, spirit, right? Tuning
yeah,
in with
yes.
what your heart says with your mind, and having that connection of the heart and mind and the spirit, um, where one feels at peace with what is happening in our environment. And I'm only speaking to
I
kind of things that I believe helps conditions, is kind of the dysregulation that happens in the body is really a factor of response. But going back to how a child is, imagine how a child grows and lives. Babies are born perfect until,
yeah,
they evolve. What is it that we can do to keep that perfection, as close to perfection in their
yeah.
life? And that's that idea of healing the well, really enlisting or inviting what is already present. And
You're saying this to me, and I'm realizing that I'm back in that rut of not having that well. I really am not. I think I'm back on the running around and on the back burner and everybody else is kind of first. And if I could magically do something, it would create more time so that I could have that focus on just me. I do think that that's really hard. I think it's hard as a woman and it's hard as a mom to just be me. I think alone time, and I don't ever really have that. I'm never really alone, and I think maybe that's what a lot of women need is just to be alone sometimes, where you can just focus on yourself. I think sometimes it would be great to just not do anything.
Yeah.
Absolutely nothing. I mean,
Yeah.
I think we're so in a society where we're constantly either scrolling or whatever, but to just really sit and do nothing. Um,
Nothing.
how would I get back to my well? Yeah. Yeah, I think it would be just sitting and doing nothing by
Mm.
myself.
Yeah. And whether that be 1 minute a day or 5 minutes a day,
Yeah, yeah.
but just even
Doing it.
that practice, just even that thought
I
brings you
think
to a
that's
place of
wrong. Yeah,
stillness, right?
right. I think that yeah, really kind of that, which goes back to those ideas of meditation and, yoga and that kind of stuff, which I was never been, a yoga person. I have a daughter who loves Pilates and yoga.
Yeah.
And I've never really been that. I'm really high strung and it's really
Mhm.
hard for me to just be patient.
Yeah.
Uh,
Yeah. Well, you mentioned your spirituality and your faith.
yeah.
And, in medicine, we often don't talk about spirituality and faith. Like, what is your spiritual practice? What does that look like for you? And where is that
So,
you?
I'm a Muslim. So as a
Yeah.
Muslim, it's in our life all the time. And I think that the benefit of Islam and being a Muslim is that we don't really rely on somebody else to give us a connection to God. You know,
Yeah.
we don't rely on going to a priest for confession or those sorts of things that my connection to God is direct. I just put a rug down and I can pray and I feel that connection. And
Yeah.
like I said, that was something that was really, important for me when I was diagnosed because I did just pray and I just prayed for that 10 years. And I did firmly believe that, look, whatever you have put in front of me is because you know that I can deal with it, whether it is my death. And I think that's the thing. I have no fear of death. I think some people are very fearful of dying, and I am not fearful of death at all.
Yeah.
I'm fearful for those that I'm going to leave behind. It's not my journey for death, it's the people I'm leaving behind that I fear for. And I think that's was what I prayed. I'm okay if you think it's my time. I'm not okay for you to leave my little kids without me,
Mm.
I'm not
Mhm.
okay for them. Um, and so I think that that, was a lot for me. Interestingly enough, for my breast cancer, all the factors, when they ask the questions, do you drink? Do you smoke? Do you do these things? None of the things my
Yeah.
faith does allow me to drink or do the, I never smoked. I just did not do those things. Everything that would have been a risk factor for me was not there. So, it is a really strange thing that it was so advanced and came. And they do think that it was probably in my body for a really long, long, long time, years,
Right.
just
Right.
never seen. But yeah, I do. I think that faith is just really, really, really important. And
Yeah. That
and I
trust,
do,
I think you speak about the trust
yeah,
and that faith and
yeah, that is
that
what
connection you
that
described.
connection.
Yeah.
Yeah. And I think if I took more time, there's not, I mean, Muslims come in all different shapes and sizes and colors and, all of those things. I'm definitely not, I'm not a person who prays 5 times a day or those kinds of things. And maybe if I did that more, it would give me that alone time. It would really be that kind of
Yeah.
moment of
Yeah.
peace. But I get caught up in the shuffle of life and all of that stuff. But yeah, I think it does have a big impact on us as people, on our culture, our faith, to deal with the issues that we have. Yeah, I don't know if I answered your question.
What do you think? Heal your well. If you had to put one word on it, heal my well, what would that be for you this at this moment? And it may
Stillness,
change.
stillness,
Stillness.
stillness,
Yeah.
stillness, and still, which is something I don't have and I probably need to
Yeah.
do.
Yeah.
And sleep, I would say.
Sleep.
I think
Sleep. Oh gosh, we could do a whole podcast on sleep. To be
women
continued.
there are women that have gone through menopause is I think
Yes.
sleep is it's a big issue. I think
Yeah.
that,
So nurturing your sleep.
yeah.
Nurturing your sleep.
And yeah, and I do. I think just stillness with
Mm.
myself. Just, stillness as one, just being one.
Yeah.
Never one. I'm all
Yeah. I appreciate, you know, you sharing this deeply personal conversation with the bigger audience and sharing to your journey. Um, it's always different and unique for each person, but there's so many common elements here that I think are important to share with as a patient, as a person in an who's gone through this journey. What would you say to your doctor now versus then? Uh, when it comes time to, when it came time to your giving that diagnosis of cancer, what would you say to your doctor that now you would have liked to have had?
I think what we're saying, kind of that stillness, that time to help process what's going on. And I think to talk about the things that they don't talk about, I think that they try, I did hear you're going to be okay, you're going to make it through this, the chances are blah, 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 all these things. But I think they also sugarcoat the difficulty of what you're going to go through because they're scared to tell you. But I think if there was more frankness on how bad chemo is and how bad the radiation is and that what the recovery is going to be like and how bad the scars are going to hurt and that you're not going to have this feeling and you're not going to have this. And I think to help women prepare for the bad part. I think as physicians, maybe they try to avoid the bad, and then it's like you try really hard not to talk about the bad and only talk about all the okay or how it's going to be okay. But I think that women need to be prepped for the bad part.
As well.
Which I mean, I don't know, maybe that's not right. Maybe then you aren't going to be able to deal with it and you just kind of take it as it comes. But, I don't know.
We talk about informed consent in medicine, but it is kind of just a mechanical informed consent.
Right,
Do you consent to a treatment that's going to have a positive effect? And also, these are the negative effects that we talk about: benefit, risk, adverse
right.
effects, but it's very mechanical. But what you're describing really is give me the bigger picture. Don't just sugarcoat it. Let me know what my options are so I can feel more
Yeah, I mean, I
empowered with
don't
the
know if I
decision.
would have, I don't think I would have changed my mind. I wouldn't,
Yeah,
as far as I was, I wouldn't have not gone through chemo and not done the
yeah,
radiation. Um, and it wouldn't have made me stop, but maybe it would have maybe it would have just made me feel more like, okay, these are going to be the things you're going to experience. Like, because like, for instance, an example, it's kind of veered off topic, but when I had my first daughter, I had her prematurely. My water broke early, just some weird reason. And they put me in the hospital and I was on bed rest. And then it became a risk of infection if they kept me longer, like kept the water in and, right. So they had
yeah,
to make a decision to go ahead and let me go into labor. And it was my first child. I had no idea what child labor, what having a child would feel like, having a baby would feel like. And I have a really high tolerance for pain. I'm somebody that has a
yeah,
high tolerance for pain. And so they, let me just go into labor and it was hurting. And I remember I, told the nurse that it, really hurts. And I remember her saying, "Oh, honey, this is just the beginning, it's gonna hurt really bad. It's gonna hurt. You need to prepare yourself." And I said, "Okay, well, when can I get this epidural thing that everybody talks about, right? Like, She's like, oh no, it's way too early. You can't have that yet. You don't want to have that yet. It's going to hurt, honey. You're just going to have to deal with this. Okay. So I was like, okay, I'm like kind of being wimpy. Like I got to deal with this. Right.
Yeah.
And everybody kind of left, and I'm sitting in this room. I wasn't even in a delivery room. It was just hurting really bad. And my sister, luckily, was doing research. She was a researcher at the time doing neuroscience research, and she was working in the basement of the same hospital. And she just came up to check on me. And I was in so much pain that I was gripping the bed handles like
Yeah.
this. And I
Mhm.
had IVs in my arms for, because all of these things. And I was gripping so hard because I was in so much pain that the blood from my arm was rushing into the IV bag up instead of,
Yeah. Yeah. Yeah.
and my sister's like, oh my God, like what is going on? I'm like, Anne, it hurts really bad. Like I'm really in a lot of pain. So she calls the nurse and she's like, hey, my sister's really like not feeling good. I don't think this is normal. And the nurse goes, oh, well, the nurse she's supposed to have is on lunch right now. And so, somebody will come in and check. And this other nurse came in and checked and she looked and she's like, okay, what's going on? What are you feeling? And I said, I feel like I have a big poop. I feel
Yeah.
like I have poop really bad. She's like, what? No, 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 don't do that. Do not do that, And she
Yeah.
looked and my daughter was
You were dead.
crowning, right?
Yeah.
About to
Yeah.
come out, right?
Yeah.
And I just remember them frantically yelling and taking the bed and rolling it down the hall because she's a preemie, right? And I'm like, I just want to push this thing out of me. I just want to get this thing out of me. Like, just get it out, right?
Yeah, yeah, that's completely what you were supposed to do at that point,
And
is
so
to push.
and the doctor's like running along and he's like, okay, okay, you know what? Just go ahead. Just do what you need to do.
Yeah.
I'm thinking I was really mad. I was like, I didn't get any drugs.
So were you more upset about and I may be summarizing it for you, but being dismissed or not being told?
Yes, I think being dismissed and not being told like what this is going to feel like. I mean, in hindsight, after I had her, it was like a super quick recovery because I had no drugs in my system.
Yeah.
I didn't have anything. I walked out of that hospital with her like, oh,
Yeah.
great, because I mean it was I had a natural childbirth, not by choice.
Yes, I had the same exact
But I think it was,
story, similar.
yeah, I
Yeah.
think it was the dismissal and then
Dismissed.
not being
Mhm.
told. So I think maybe that trauma stuck with me. So all through chemo, I was like, well, maybe it's supposed to feel like this. Maybe I'm
Yeah.
not like I'm being too whatever.
Yeah.
I'm okay. This is not that bad. I can deal with it. And the funny thing is, chemo really wasn't as bad for me. It was the radiation that was really bad.
Yeah.
The radiation got me because the skin gets burned so bad and nobody
Yeah.
talks about that. Again, nobody talks about that, like almost fourth degree burns under your
Yeah.
armpit and like it
Yeah.
really hurts and you can't bend
Yeah.
and I'm like, those were the things that I'm like, God, somebody's really got to tell people that this happens, and it's going to
Yeah.
feel really, really crappy for a while, but you will get over it. I think
Yeah.
that's the thing. Like you do heal, it does get better, but
Yeah.
it's really going to suck for the time that it's there. And I'm
Yeah.
the person that I need to just hear that. I'm here that it's going to be really bad.
Yeah.
It's going to be okay. You
Yeah.
just pass the bad.
Hmm. You want to know the roadmap, right?
Yeah, I
To
really
getting.
need to know
Yeah.
what I'm going to face.
Yeah.
Really need to understand what the journey is. I
There
think
you
I'm not.
go. There you go. What we can learn from your experience, and what you can learn also from how that experience can translate over into, the
Yeah,
next
yeah,
encounter of illness.
yeah.
I want to thank you for really sharing this time with me, and with so many others as they listen to this podcast. Again, this is Two Curious MDs. We're asking those unasked questions, really in integrative medicine and in narrative medicine, and using those methodologies to really help in healing and the alchemy of what that brings to so many others in their healing journey. So thank you.
Oh gosh,
Pause
thank
here.
you so much for
Oh,
helping
sorry.
me
Sorry.
and
Sorry.
allowing me
Let,
to.
let me finish. Why don't you finish? Sorry.
No, that's okay.
Ever.
I would just say just thank you so much and allowing me to just kind of regurgitate everything out there. And I
Oh,
think
this is beautiful what
that's
you shared.
therapeutic itself. I think sharing and, um, I do think it's important to, if somebody faces this journey to talk to someone that's already been through it. And I do try to do that as well. Cause I did that myself. I had a friend who had went through a journey very similar to mine as far like the same stage and as advanced. And I couldn't have done it. I couldn't have gone through it without her, without calling her and talking to her and hearing that, because I think different stages and different people have different, it's all different. And she was someone that was a little similar to my journey, and she survived, and she also survived brain cancer. And it was like
Mm.
huge for, she's also a physician.
Oh,
And
wow.
she really was impactful on my life in that. And so I've tried to continue the things that she does. And so she talks to people, and I thought it's great to talk to people. So thank
Wow.
you.
Thanks for joining us on the Two Curious MD podcast. We hope today's episode inspired you to ask new questions and explore fresh perspectives. We challenge you to ask us those unasked questions that you're curious about in your medical practice, condition, health, and wellness.
If you enjoyed the podcast, don't forget to subscribe, share it with somebody just as curious, and leave us a review. It helps us keep the curiosity alive. Post or comment with a question or curious inquiry that you have and seek to explore or learn with us. Stay curious, and we'll see you next time.